Oh, and welcome to another edition of Build Healthy Places Network's video snapshot series. My name is Alexis, and I'm the communications specialist at Build Healthy Places Network, a national center fostering cross-sector collaboration across healthcare, public health, and community development to accelerate community-centered investments that advance health and racial equity. This popular video series provides brief insights into the work of practitioners, experts, and organizations from the community development, health, and finance sectors working together to make communities healthier. The series uplifts practices, projects, and policies that support community engagement processes that are community-led and owned. In this interview, we are going to talk about the Healthy Neighborhoods approach, which works collaboratively across sectors to address the health inequities that impact the conditions of the neighborhoods we live in. BHPN has been focusing on how the public health and community development sectors can join forces to transform the way we approach health and well-being by creating equitable opportunities for disinvested neighborhoods to thrive across the country. I'm so excited to speak with two leaders from East Bay Asian Local Development Corporation, Ener Ledbury, who is the Associate Director of Creative Community Development, and Ener Chiu, who is the Executive Vice President of Community Building. Thank you so much, Ener and Ener, for joining us today. My first question is, in the development of the Healthy Neighborhoods approach to community development, East Bay Asian Local Development Corporation focuses on non-medical factors such as the conditions of the neighborhoods we live in that directly influence our health. Can you share how this approach fosters upstream cross-sector collaboration to prioritize residents' needs?
Yeah, thanks for the question, Alexis, and it's so nice to be here with y'all. I'm going to use a number of acronyms while we talk, mostly so I don't have to say the words over and over again. We have a really awkward acronym at East Bay Asian Local Development Corporation, which is EBALDC. EBALDC. So we'll probably say that word a lot in the course of our conversation. EBALDC is a almost 50-year-old nonprofit community development organization, and we were founded in Oakland, Chinatown, and primarily as a real estate nonprofit organization, first doing affordable commercial spaces to help incubate a lot of other nonprofit service organizations that were trying to help our monolingual, low-income Asian population here in Oakland. And eventually, we kind of grew our real estate portfolio out to East Oakland and then West Oakland as well. And all three of these neighborhoods were historically redlined neighborhoods that did not get a fair share of public or private investment. So there was a lot of housing discrimination and also financial lender discrimination, and that really prevented a lot of resources from going through these flatland communities here in Oakland. And so after a couple of decades of doing mostly kind of affordable housing and commercial real estate work, we noticed that, or we came to the understanding that we were really not as impactful as we wanted to be in our neighborhoods. A lot of this research came out of the Alameda County Department of Public Health leader at the time, Dr. Tony Iton. And his kind of conceptualization of these kind of social determinants of health, or social determinants, which is a realization that many of our residents and individuals' health in general is not only reliant on just the medical care they receive, it's also reliant on the neighborhoods that they grow up in, that they live in, that they work in, that they play in. And this stunning realization that, like, a white family up in the hills of Oakland has a 14-year lifespan over a difference, increase over, for instance, a Black family living in the flatlands of West Oakland. And so the nature of that inequity is what we really started to focus on. And we started to realize, like, gee, our programming is not only broad itself within our organization, but it actually helps support many other organizations that are doing really, really important work as well. And so, and that's kind of how we got started in thinking about this in terms of our community development work as kind of really public health oriented and focused on the social determinants of health. And Annie, we were so lucky to bring on Annie a number of years ago to really do a lot of cross-sector partnership, which I'm happy she's here to talk about today.
All right. Yeah, thank you so much for having us. So in my role with in our Department of Neighborhood Collaborations, which also includes our creative community development area of work. So it really brings the healthy neighborhoods approach beyond the core pillars of what EBALDC does, which we'll talk about a little bit later, and kind of brings this healthy neighborhoods approach by working with cross-sector partnerships in place-based collaboratives within the neighborhoods that Ener mentioned earlier: East Oakland, the Havens Court neighborhood of East Oakland, Oakland's Chinatown, and along the San Pablo Avenue corridor in West Oakland. And so we convene and facilitate these place-based collaboratives where residents are really at the heart of that they're driving both the priority setting for the collaboratives alongside a diverse kind of cross-sector partners, including community-based organizations, kind of government staff, individual people across education, arts, business. Really, it really is responsive to those goals that the residents help to set. And then we use a collective impact model to do that as well. So and I would just say that so since we started really working in this way of thinking and with these sets of partners, since 2013, we've engaged 96 different partners across those neighborhoods. And we've worked really deeply with 337 resident leaders and counting. These are numbers a little bit old, but just to show kind of the quantity and alongside the quality of the work.
Yeah, thank you so much, Annie, for sharing that. Wow. I love how you guys keep residents, centered, as you are creating those upstream cross-sector partnerships to address those social determinants of health and, improve their built environment. So I absolutely love that. You mentioned the healthy neighborhoods approach and the 4 pillars that you guys focus on at EBALDC to support community members' overall health and well-being. Can you share more about this, about the 4 pillars of the healthy neighborhoods approach and how this approach centered residents and community engagement throughout the decision-making process?
Oh, you're on mute, Ener.
So sorry, you'd think I'd learn how to do this by now. The 4 pillars are really just, I think, our own admission that not one organization can do everything. So if you've seen any literature on social determinants of health, there's like 12, 15, 18 different slivers of things that are important to kind of neighborhood and individual health, right? They range from access to quality education, access to clean air, and in those environmental cleanliness, access to affordable food, access to affordable housing. We realize that at EBALDC, we're one organization. We can't do all of that. And so that's why kind of Annie's comment about collective impact is so important. The 4 things that we can focus on, though, that we have historically done pretty well are creating access to affordable housing. That remains one of our primary program areas. Creating social connections to other individuals and also to agencies and folks that can help residents with their day-to-day needs. Economic opportunities is the next one, and that is really focused on helping our clients become more economically self-sufficient over time. So connecting them to resources, connecting them to financial coaching, other ways that they can get money that they are entitled to supplement their earnings. And then the last one is really kind of strong neighborhood partnerships. And this is kind of the realization that, we can't do everything, but we can create an infrastructure to really help organizations align their actions for the purpose of creating collective impact. Annie, do you want to talk a little bit about kind of resident voices?
Sure. Yeah. So those are the 4 pillars are the key things that EBALDC contributes to our collaboratives, and the work that we do in Neighborhood Collaborations Department is we hold the backbone that helps to is the glue that holds these collaboratives together. And we're not always in the backbone role in collaboratives or coalition work. We have we have experience with kind of founding collaboratives and being kind of founding partners, but we also are happy to play kind of contributing partner roles. So yeah, the way that we kind of set those sets of priorities and those action plans is that we go through a really thoughtful listening process, really over the course of, usually it's about a year, and we use different strategies to really reach people where they are, to think about, for this particular place at this particular moment in time, like who are the most impacted, who are the people that don't usually get heard in processes like this, where you're setting priorities of what, you know, multi-partner stakeholder groups are going to work on, really. And so that is one of the places where arts, culture, and creativity can support traditional methods of data gathering. So there's population level data, and then there's kind of on the ground discussions, you know, in front of the grocery store, or at the block party, or at a lot of existing meetings. There's a lot of kind of these smaller neighborhood groups that already exist. And so we really try to reach both the trusted messengers within different places to help us to hear what it is that people care about the most. And then within that, what are all these different groups, or where is the energy, and how can we work together to align that energy and follow the energy and strengthen it, and attract resources to it, because that's essential for getting things to move, right? That's a benefit of working in this collective impact model. Yeah, and I'd say that my heart is really within this creative community development, which can be more broad, you know, like art within affordable housing development, right? Public art. There's really fun, lots of really fun examples. The parts that are I think the most powerful are where arts and culture is really deeply tied to the development of resident leadership, like individual and collective expressions of what people want to see, not just with words or with filling out a survey, but really like what is it embodied to really advance racial healing and foster a sense of belonging. So yeah, I think all of those pieces kind of came together around one of our, we did a renovation of a senior affordable housing building that we've owned for, I think, at least 20 years on San Pablo Avenue, the San Pablo Hotel. And as a part of that major renovation, which really, you know, improved the community space, the kind of commercial space on the ground floor, kind of the resident experience, and the apartments. They also really invested in the co-design of the garden, the backyard garden, alongside resident leaders. And there already was some grassroots gardeners, like literally growing grass, like growing in the yard. And so we spent like at least 8 months working with people over and over again to ask them, like, okay, what do you want? What are these different decisions within the design process? And then there's a beautiful mural that was also a result of kind of the continuation of those series of conversations that you can see it on the backside of the building. And it really like shows off the resident leaders themselves and kind of memorializes them in this like larger than life format. And there's a story with a QR code of like what was the process, because the process is just as important, even more important than the physical product. So that's just an example of what it could look like.
Absolutely. Thank you so much for sharing, you know, about EBALDC's resident leadership and how that creative community development integrate arts and culture into the programs, because like you said, it does create that and foster that sense of belonging and advance racial healing. And I did read the San Pablo Hotel renovation story, I believe, in the 10-year report that you shared with me, and I would love to include it as a resource along with the video snapshot, because I feel like, you know, just watching the video was just so rewarding to hear how residents were impacted by the project, how everyone was able to come together and contribute, and their voices were definitely heard. So thank you for sharing that. So moving on, so for public health practitioners looking to collaborate further upstream with community development to advance racial and health equity efforts, what do you think are the key elements to overcoming barriers to working collectively to promote neighborhood level change?
Yeah, well, I would say there's a lot of education that goes into this. I mean, and I would say that, you know, the things that we talk about sometimes, like collective impact or, you know, public health, like these are concepts that are kind of abstract. They're not necessarily things that kind of stick in your mind, like upon first kind of glance or reading. And so one thing about this terrible period that we've all been through of COVID is that it made those concepts very real to people. Like COVID is very easy to understand as a public health emergency where not one person's behavior alone cannot prevent you from getting COVID. Like you have to work together as a society to, you know, minimize the amount of kind of transmission that happens. We have to vaccinate in order to kind of protect ourselves, but not only just ourselves as individuals, but ourselves as communities. And so I think during that time period, things got very concrete and very real. And I think the Alameda County Public Health Department in particular realized that the best way of getting education out there about COVID, fighting misinformation in communities, is to have trusted, you know, you can print out as many white papers and as many fact sheets and as many whatever. There's nothing as convincing as having a trusted, a person that you trust tell you, hey, this is something that we should do. This is something I'm going to do. This is something you should do, and it's going to help protect all of us. So having those partnerships between public health agencies and community trusted organizations like us and many of our partners who are out there doing work in communities as well is so important in that education process and also in vaccination uptake. I'd say the one challenge of kind of ongoing in working with public health agencies is just that once that emergency period has passed, sometimes like it's very easy to say like, hey, that period has passed, we got to prioritize money to other things. And so, you know, it's like keeping that understanding alive in public budgeting processes that like even after an emergency has passed, you still need to invest in those networks to keep them strong. I'd say that's an ongoing challenge for us.
Thank you.
Annie, did you want to talk about kind of public health and kind of transportation and safety, and then I can wrap?
Yeah, I think that we've had an evolving relationship with the Department of Public Health and other kind of public health related entities and allies and partners. And really, I think what is really exciting about being in this space of connecting many different cross-sector partnerships and really trying to build our strategies around data and connect that data, which can be super abstract, to tangible actions and like making a case for something that people know, like it feels like they know that they need it, but like it helps to make a case. And so we've been kind of rekindling a collaboration with the public health, their data folks around taking action. Residents really want to shape the San Pablo Avenue corridor. There's a transportation commission plan that's coming, you know, it's in the works to kind of connect Oakland all the way up to the city of San Pablo. So it's a major corridor that's also like the heart of one of our collaborative areas. And so working together with them to kind of continue to build the case and think about like, what are the pedestrian collision data? What's the air quality data around that, like the freeways that cut through our neighborhood? And then what are the other kind of safety factors that the transportation folks should be hearing from the health folks in and with residents at the heart, kind of driving what is the most important, and then shaping a major physical investment that will kind of could unite or divide, like in the way that transportation has divided in the past. Like it could be actually a space of healing and design, like a different way of working together across these sectors.
Yeah, but all of that work is so, I'd say, challenging and long-term. We've learned a lot of lessons over 10 plus years of doing this work. And we don't, I think we've done some things really, really positively. And we've also like learned a lot of things like, oh, we didn't do that right. Like that was really tough. I think the one key thing that I would end with maybe is that like the most important thing is like building trust. And how do you build trust? Not only between public agency and community, but across communities, across community partners, across racial and cultural groups. We've been segregated from one another for a long time. And as a result of that, like, and we speak different languages sometimes, and we just like, all of those things are not insurmountable, but they require trust to get through. And the only way you build trust is by consistently investing time. And that consistently investing time part is really tough for community developers because we're all running operations on a shoestring. And so to think that like, hey, we're going to talk to these other organizations and kind of like just spend retreat time over 3 or 4 years, maybe when we're not working on anything concrete, but we're just trying to build a relationship, that's hard for anyone to do. And it's hard in this environment where there's a lot of employee turnover at all levels. Like, so that kind of community trust is really something that's so valuable, as we saw in COVID, but it needs nurturing in non-emergent times. And that's really tough to do.
Absolutely. Thank you guys so much for sharing that, sharing the challenges, sharing what's needed, nurturing those relationships and building trust is so important. I know when we previously spoke to you guys, you mentioned that you guys were trying to work with public health to utilize the ARPA funds, but it was extremely challenging. Do you ever see EBALDC going after and utilizing the ARPA funds post-COVID, and what would you utilize the funds for?
We hope so. We hope so. We hope that there's, we hope that there's some left, but that's exactly what we're talking about, right? Like the emergency period has maybe passed, but the need to maintain organizations as trusted community kind of anchors has not passed. And so if we are fortunate enough to, 1, see that those ARPA funds get made available, 2, apply for them, 3, get awarded them, then what we would love to do is to be able to fund one of our collaboratives to really make sure that they maintain those ambassador staff who were, community health workers, they were promotoras, they were like people that were getting to know their neighbors and had the impact of being able to pass on information, education, and resources. So the COVID era has passed, but people are really struggling with access to affordable housing, maintaining their housing, and maintaining and getting kind of better paying jobs that can help them become more economically self-sufficient and lift them out of poverty. That's what we want to change our focus to, of those promotoras and community health workers, to make sure that those people are educated with everything that they need to find a great job, to get the affordable housing that they need, and that they have a resource to go to help them kind of navigate what is unfortunately sometimes a very bureaucratic and kind of painful process. So that's what we're shifting the focus to post-COVID.
Thank you, Ener. That's very helpful. And yes, that just reminds me of the vital conditions framework that a lot of us has been recently introduced to, that urgent services can be life-saving, but it will not produce a thriving long-term environment. So it's, very important that you continue to establish those relationships post-COVID and, outside of the emergency. So thank you both, Annie and Ener, for joining us today. You've shared a wealth of knowledge on upstream cross-sector partnerships, how EBALDC, keeps residents at the center, keeps their voice at the center to promote and foster a sense of belonging to improve their overall health and well-being, as well as their built environment. So we greatly appreciate you. We want to thank the audience for joining us today as well. And I hope you will tune into our next video snapshot series.